It's very clear that there's been a huge development in emergency medicine in Romania over the last 16 years. And I've been coming here since 2000, and it's undeniable that there's just been major advances in both pre-hospital and in-hospital emergency care in Romania. And the level of conversation has changed very much from a let's catch up to let's try to be cutting edge. And it's very obvious that a lot of what's going on now is very much cutting edge emergency care. And I think the biggest examples are the fact that, patients who have some of the major pathologies in Romania are very much, the expectation now is that patients will be treated with very contemporary treatments. So, particularly things like using tissue plasminogen activator for patients who have acute stroke. There are now protocols in place to make sure that patients get these kinds of treatment. For patients who have certain kinds of myocardial infarctions, there are protocols now in place to make sure that patients get interventions quickly and efficiently. And that's really quite a change from when I started here 16 years ago. The purpose of my visit over the last week has been to go and hold 3 different meetings. We had a 3-day meeting on emergency department management, and this was really for the managers of the biggest departments in the country to talk about different management techniques that were specific to emergency departments, and really how do you measure quality, how do you improve quality of emergency care, how do you ease crowding in emergency departments and improve flow through them, and how do you make sure that the care that's being provided by all of your emergency providers is as uniform and consistent and top quality as possible. So we did that for 3 days. Then there was a 1-day meeting with the trainees in emergency medicine to discuss with them what they thought the strengths and weaknesses were of their training programs. And at the same time that we were meeting with the trainees, we also met with the emergency physicians in charge of emergency medicine training so that they could give their perspective on what they thought the strengths and weaknesses of the training program in Romania is. And then the last part, which we've just finished, was a 3-day session to wrap up this 2-year program that we've had to develop really algorithms and guidelines for emergency care in Romania for the major pathologies. So people from different emergency centers in Romania have had the responsibility to develop particular well-articulated pathways for treating major pathologies, and they have gone and have these criticized by their colleagues, and then that's been pretty much a 2-year process. And then over the last 3 days, we've all gotten together to say, this is our final product, this is what we would like to establish in the country, and let's talk about, make sure that we all really agree on this, put it in its final form, and then hopefully we'll be able to break it out and deliver it so that it'll be of use in the other 63 emergency departments in Romania. There's no question that for emergency care, Romania is certainly well advanced of many countries now, and that is, that is true, I think, all over the world. I think Romania is certainly well advanced of the vast majority of the world. I think in terms of your question about waiting times are an issue everywhere in the world. I think the fact that Romania has a much better handle on measuring waiting time and trying to improve waiting time already shows how advanced you are. I think there's no question that the strongest part of the emergency care system in Romania is the pre-hospital care. The advanced pre-hospital care that has reached the entire country over the past few years is without a doubt a system that other places in the world should be emulating. And it is certainly much more sophisticated than the pre-hospital emergency care that exists in most of the United States. And the fact that this has been developed so quickly and efficiently in Romania is quite remarkable. And that is, without a doubt, that is the strongest part of the system. I think it's a great project. I mean, the emergency care has evolved so rapidly in Romania that it's really at a point now where trying to create uniformity and trying to create accountability is really the next step. And I think this project has been incredibly effective in trying to establish this and make sure that these are sustainable ideas within emergency care in Romania.